Dr. Samuel, what is the difference between a dental exam and a cleaning?
So a dental exam is when the dentist will come in and physically check your teeth, look at your x-rays, look for any concerns in the x-rays like cavities or bone issues, check inside your mouth, and again, check for any cavities, signs of infection, things like that. A dental cleaning is only when you get your teeth cleaned by the hygienist. So the hygienist is not examining your teeth. They may look for certain things with your gums, but they're just cleaning your teeth, removing the buildup, and the dentist is the one who, with their exam, can diagnose you.
How long does a full dental exam take? And just repeat it. I think your dad was saying you may ask how long the exam may take. But just make sure to repeat the question.
Okay.
So how long does a full dental exam take?
So a full dental exam, the amount of time that would take would be probably, I would say, around 20 minutes for us to check. We check on the outside of your face, we check on the inside, we check your muscles, we check your jaw here, we check your teeth health, we check your gum health. And then after that, I just spend most of the time talking to the patient about my findings and any questions they have.
How often should you have a dental exam?
So how often should you have a dental exam and cleaning? I would say for the average healthy patient who is being seen at least twice a year, for those patients, patients who have gum disease, things like that, we recommend 3 to 4 times a year to make sure that things don't spiral out of control. I know a lot of patients think they just have to come once a year because that's how often they see their doctor. But we actually like to see them twice a year because of the amount of bacteria buildup that can happen in the mouth that can lead to other issues.
How can a dentist tell if I have cavities?
So how do we diagnose cavities? Well, we like to use x-rays, those uncomfortable things that you get done about once a year, biting into those little square things. Those really help us because cavities really form where the teeth touch, and we can't see through your teeth in your mouth. We need the help of x-rays. So that's one way. We look at the x-rays, and then we also compare that to what we see physically in the mouth. So we're able to see certain cavities inside your mouth clinically, and other ones we're only able to diagnose by looking at your x-rays.
Do dentists fill cavities on the first visit?
Well, and on your first visit, if we have time, sometimes we can do same-day treatment. Filling cavities on the same visit, we may be able to, but for the most part, we do like to do a full exam, check everything, and come up with a plan for you. If we do have time and there is a tooth bothering you, we are happy to accommodate you and do that treatment if we have the time.
I'll let dentists know if I need a root
Okay.
canal.
Sorry.
No,
How do we know as dentists if you need a root canal? So there's several things we look for. One thing would be a very large cavity that we can see in your mouth, and maybe there's swelling or some infection that we can see near where the tooth is in your gum. The other main way is we look at your x-ray because that will show any infection in the bone or large cavity that's causing this need a root canal.
Okay. Are dental exams painful?
Are dental exams painful for the most part? No. I mean, some patients do have tenderness when we check their gums, but nothing that requires like numbing or anything like that. We're really just, going like this, checking inside your mouth, so it's nothing invasive.
Is there anything I should do to prepare for a dental exam?
How should you prepare for a dental exam? I would say the most important thing that helps us is making sure that if you do take medications, please come with your full medication list. a lot of patients think that medications are totally separate from dental, but in actuality, some things that you may be taking or some medical conditions you have can impact us being able to do dental work on you. So we want to make sure you're safe, and so we have all the information. So any medical condition, if you can't remember it, just maybe have a note in your phone that you can just show us with your medications, medical conditions. That way we're all on the same page.
How can I schedule an appointment for a dental exam?
How do you schedule an appointment for a dental exam? All you have to do is call us. We'll be happy to get you in.
This one's a blurb. I don't know if you got it. And then it's still recording.
Oh,
The call to action. It's kind of like the ending of the question and answer
gotcha.
portion.
Okay.
Okay.
So I hope these answers have helped answer some of your questions about dental exams and what they entail and what to expect. If you have any more questions or you'd like to meet us, please give us a call at 301-604-0025, and we'll be very happy to meet you and help you.